Today I'm going to be doing the intramuscular competency. So first I'm going to verify my care/order for my client. I have an order for 50 milligrams of phenergan at a concentration of 25 milligrams per 1 milliliter. So I'll be giving 2 milliliters. And then I will perform hand hygiene before and after handling any supplies or giving client care. And then I am going to verify the facility policy and procedures and assemble my appropriate equipment/supplies. So for an IM injection, I'm going to need my 3 milliliter syringe with my 20 to 25 gauge needles. I'm going to need 2 needles for this injection, and then I'm going to need my phenergan and my 2 alcohol swabs. And then I'm going to consult manufacturer's recommendations when equipment is involved, which is the safety on my needle. And then I am going to draw up the correct dosage. So first, I'm going to clean my vial with my alcohol swab. I am going to draw up 2 milliliters of air. Using the scooping method, I'm going to recap my needle. So for this competency, you need to replace your needle because once this goes into the vial, it is now dull, and you don't want a dull needle going into muscle. I'm going to show that it's 2 milliliters. Then I will put my new needle on. Depending on the site, depends on the needle length. So if I was giving it in the vastus lateralis, I'd use a 5/8 to 1 inch needle. If I was putting it in the deltoid in children, it would also be a 5/8 to 1 inch needle. If I was doing the deltoid in adults, it would be the 5/8 to 1 1/2 inch needle. And then if I was doing the ventrogluteal, which we only do on adults, it'd be 1 to 1 1/2 inch. So then I'm going to knock on my client's door, and I'm going to introduce myself. Hi, I'm AJ. I'm going to be your student nurse today. I'm from West Kentucky Community and Technical College. Then I'm going to identify my client by the 2 patient identifiers, name and date of birth, while I check her wristband for confirmation. After I've confirmed that my patient is who I have the order for, I'm going to explain the procedure. Miss so-and-so, I will be giving your phenergan IM injection today in your vastus lateralis. And then I would provide for privacy, elevate the bed for good body mechanics, and while I do all this, I would note the client's overall condition. So if I was giving the injection in the vastus lateralis, I would divide the anterior thigh 3 by 3, and I would inject in the outer middle third. And then if I was doing it in the deltoid, I'd find the acromion process 2 finger lengths down. That gets the base of my upside down triangle, and then I would inject in the middle of that triangle. In the ventrogluteal, I would put my palm, I'd use my left hand on the right hip of the client and use my palm on the greater trochanter with my thumb towards the groin area, my index finger on top of the iliac spine, and then I would use my middle finger towards the buttocks, and I would inject in the middle of my index finger and my middle finger. So then I'm going to don my gloves. Like I said, I'm going to do it in the vastus lateralis. Using the bullseye method, I'm going to clean my injection site. And then I'm going to use the Z-track method to move the subcutaneous tissue out of the way while I inject into the muscle at a 90-degree angle. I'm going to aspirate, making sure that I'm not in any kind of vessel and that I am in muscle. Inject my solution, pull out at the same angle I inserted in. Then I'm going to do my safety. Discard my syringe in the sharps container. I'm going to remove my gloves and dispose of them. Perform hand hygiene. I will lower the bed and apply side rails as indicated of the client's care plan, and then I'm going to place the call system within reach and document on my MAR. If there is any abnormalities, I would report to my charge nurse immediately.